Hey everyone, I have a break. So as I mentioned earlier, if you saw my Facebook post, um, you know, working frontline job here in Vancouver during this COVID-19 lockdown in our city, and being part of essential services. I just wanted to share with you a few insights and observations and what my day, I can't speak for anybody else who does this kind of work, it has been like. Worked 16 hours yesterday, went home, grabbed not quite 5 hours sleep, and up and at 'em this morning. And right now I'm in between um, places, so I got away a little bit early from one of the houses. Now I'm on my way to another one. And I'm tired as hell, but I think in a good way. It was chill at the house I was just at. I just came from these guys. These guys, essential service people, all the way, man. I'm telling you, I don't know what I'd do if they shut down Starbucks or any of the 8 gazillion coffee shops here in Vancouver. I guess that's something we have in common with Seattle. So a couple more things I'd like to share. We are at the very beginning of all these self-isolation and quarantines and all that stuff. And it is definitely going to get worse before it gets better. You probably don't want to hear that, but it's the way it works. And here's something. Vancouver is a wealthy city. It's the most, I don't know if it's the most expensive in Canada. Maybe Toronto and Vancouver about the same. But I think Vancouver's a little more expensive. Houses here, your average detached home is well over $1 million, and that's for an old house. That's not like anything new. And I'm just going over this for the benefit of people who don't know what it's like to live in such an expensive city. But you know what? Most of us are just average people, and we're all hardworking folks. And then for those of us who live in places like the downtown east side, they get the hardest hit, man. But even regular folks, it's going to be a big wake-up call, because regular people who probably really didn't have to worry about too much of anything are now starting to freak out. And I can understand it, because if you have kids, and you're now worrying about your mortgage, you're now worrying about paying your rent, your bills, and stuff like that. Many people in this country, as wealthy as it is, are only a couple of $1,000s away from poverty. And there's lots of stats to back that up. But I guess what we need to keep in mind right now is staying safe, for everyone. And if you are not affected and you find yourself in a position to help others, please help others. Pitch in. When you're at the grocery store, man, let old people go in front of you. If they have groceries, just be decent. I can't mention enough, don't hoard food, because that's not helpful for anyone. Don't do that. And don't spread misinformation. Just pay attention to what the health authorities are saying. As I mentioned before in my last video, the people you need to listen to are Health Canada, the CDC, the WHO, and your provincial health authorities. And the same goes for everybody in America. Listen to your local and state and federal government health organizations. They're the only people who have the information that you need. So having said that, now we got to settle in and we got to hunker down. And we really need to be there for one another, for sure. You know, I was thinking too today about other jobs out there. There are a lot of people who work in fast food, and that's still going strong. But these are people who, again, I can't stress enough that they don't have benefits, they don't have health insurance, they don't have all the things you need. I know everybody who is not from Canada is thinking, hey, we thought everybody was covered with the health thing in Canada because you guys are a bunch of damn socialists, goddamn communists in that country with your socialized medicine. Well, you know what? We have a great healthcare system, but it doesn't cover everything, right? So if you don't have extended medical benefits from the company you work for, you are shit out of luck for some things, and you still have to pay for all your prescriptions. Medicine is not cheap, man. And if you get a serious illness and you need expensive medicine, how are you supposed to pay for that, right? So, yeah, all the people who are still working in fast food, cheers to you. You know what? I'm going to get me some of that in just a few minutes because I have a bit of a break before I go to my next job. So, yeah, I'm just going to keep you posted throughout the day. We'll see how things go. I hope it's going to be chill tonight on my next shift. I'm going to be dragging my ass come midnight tonight, tell you that much. Go home, sleep. Got one more shift tomorrow. And then, wow, 2 days off. Hopefully 2 days off. Hopefully my phone doesn't ring saying we need you someplace else. And I can just rest up and do it all over again on Monday. Let's keep the conversation going, right? Let's come up with some good solutions. Let's hope that we come up with solutions that are lasting and that things are actually better when this whole thing is said and done and over and the smoke clears. Maybe we're going to start taking better care of one another. Maybe we are going to do a better job of taking care of vulnerable populations. Maybe we're going to do a better job of keeping, taking better care of ourselves. Because self-care, all you frontline workers, you know this stuff, but we never practice what we preach. Take care of yourselves, right? When you get some rest. Exercise if you can, meditate, do whatever it takes. So I'm going to go and find one of those fast food restaurants that I talked about right now, I think, and grab some lunch before I continue on my journey on the front line during the Covid-19 pandemic 2020 here in Vancouver, British Columbia. I'm making it sound like it's a sporting event. It's not. But stay safe, stay home, wash your hands. I'll check in with y'all later.